Welcome back here to New Day Cleveland. May is Skin Cancer Awareness Month, and today we are talking about the deadliest form of melanoma. So here to help us out is Dr. Jorge Garcia from Apex Skin. Thank you so much for joining us, first of all. We really appreciate it. How are you doing today?
Good. Thank you, Natalie, for having me today.
Oh, we appreciate you being here. This is a very important topic, and we love on these awareness months to really get things like this out there. So I'll just have you start to break it down for me. First of all, what is melanoma?
Melanoma is a very common type of skin cancer. And in fact, in May, Apex always does a big, Melanoma Awareness Month campaign to make sure people are aware of what to look for in their bodies to spot melanoma. So it's a very common type of skin cancer. Usually looks like a little beauty mark or a mole.
So I think that's where people might maybe mistake it. They think, oh, it just is a mole I've had here. How long, I mean, is this something that someone could have had for a while before they really notice a change in it? Or how often should we be getting checked to make sure that something that we thought was maybe just a beauty mark isn't something more serious?
Yes, so we always tell people A, B, C, D, E's of melanoma. When you check your skin, look for A, asymmetry, something that looks a little funny with irregular borders. B is border, irregular border. C is color, different colors within a mole, brown, blacks, grays. D is diameter. Anything that's bigger than a pencil eraser should be evaluated. And E is evolving, something that's changing. If it gets bigger, it's getting crusty, it's bleeding, or it's painful. Usually melanomas are flat. But if you have something that's new in your skin that all of a sudden it doesn't look right, our recommendation is come see us right away because it could be a melanoma or other type of skin cancer.
Now, even if you aren't prone to having, these beauty marks or spots on your skin, are you still supposed to be going to, they say, the dermatologist on a yearly basis, every other year, to make sure of everything being okay?
Yeah, the guidelines for skin cancer, once you've had one, you should be seen every 6 months or twice a year. If you've had melanoma, it should be every 3 to 4 months. But if you never had skin cancer, we would always recommend a baseline skin check, especially if you're very moly, because in dermatology we're kind of trained to look for atypical things, and we look for the ugly duckling sign, which is, hey, a lot of times you can't really see your back or the bottom of your feet. So that's our job. We look into your scalp and to make sure that we do a thorough checkup to make sure that there's nothing atypical. And if it is, then we do a small biopsy to check first.
So, and we're looking right now on the screen, Doc, we have up where you can get melanoma. So, I mean, it can pop up anywhere on your body.
Yes, melanoma can happen anywhere. It doesn't necessarily need to be in sun-exposed areas, although those are very common. Usually, guys get it in the back or the belly, but the ladies will get it on the lower extremities. But honestly, melanoma can happen in the back of the eye. It can happen in the mouth. It can happen in the genitalia. It can happen in the brain. So it's one of those things that is asymptomatic. So usually it doesn't have any symptoms. You don't even know you have it. That's why it's important to be vigilant and
Wow.
check your skin every once in a while, and come see us once a year.
Now, you're mentioning spots that people wouldn't normally think of, the back of the eye, inside of your mouth. So clearly then what I think it would sounds like is very important is to make sure you're going to get those eye checkups, to make sure you're going to the dentist, because these doctors might also catch these things.
Absolutely. We work hand in hand with our colleagues, and oftentimes we send people to the eye doctor to get the retina checked. We always get some referrals from dentists for people that have lesions in the lip. So it's all about being proactive. And in May, we try to tell people, hey, 1 in 5 people will get skin cancer in their lifetime. So make sure you check your skin. Utilize May as a reminder of, hey, let's go to the dermatologist. Let's go check on my skin, just like you go to the cardiologist or your
Hmm.
primary care doctor. Dermatologists are trained to look at your skin and identify the irregularities. And trust me, a lot of times people come into the office with one thing that they think is wrong, but that's usually it's fine. But then we find another thing
Sure.
during the same visit that's a skin cancer.
So can I just quickly ask you then too, is this something, someone could have lived with, say, a spot their whole entire life, and then all of a sudden it can turn into melanoma? Or is it something that you would notice that is a new formation on your body?
Great question. There are melanomas that start de novo, meaning that from the day one is a melanoma and you have a new spot that you check. But there are people that have a lot of moles and they turn over time, especially if you've done indoor tanning or if you've done an outdoor profession with constant sun
Hmm.
exposure. If you notice some changes, so there's data out there that you have a mole that starts when you're in the 15 or 16, and then over time it starts changing and there's progression, and those are called dysplastic nevus. So there's a little bit of progression into the mole, and then those turn into a melanoma. So a little bit of both. That's why you have to be vigilant and look at your skin and get it checked if you get a new spot, especially if you're over 30.
Well, I'm glad that we spoke with you today because it's a reminder for me I have to schedule my appointment because I like to go at least once a year just to feel safe about everything. So Dr. Jorge Garcia joining us again from Apex Skincare. We appreciate you very much coming on and speaking with us, especially this month. So thank you.
Thank you very much. We have a lot of information at apexskin.com. And, happy Mother's Day to all the great
Oh,
moms out there.
you
Thank
are
you very
too
much.
kind. Have a wonderful day. Thank
Thank
you,
you.
Dr.
Bye bye.
Garcia.